Maureen and Nyao for making time for me this afternoon to provide an update to the community. I hope all of you are continuing to do well as we deal with this pandemic that we're going through. Also want to mention, as Reen has already mentioned, that we are streaming live on our Facebook page and recording this to share at a later date. And again, only questions will be taken by calling in to CKON at 575-2101 or 358-3427. It's now been nearly 5 months since we declared a state of emergency in our community of Akwesasne. As always, I want to acknowledge that dealing with this pandemic and practicing all of the necessary precautions has and continues to be challenging for all of us. On behalf of myself and council and the Mohawk Council of Akwesasne, I want to thank everyone who continues to practice all of the recommended precautions in our fight against the spread of the COVID-19 virus. We don't want people to adopt a false sense of security about this pandemic. It is not over and everyone is still at risk. We have to continue to be smart about this, wear a mask and maintain a 2-meter distance from others when in public. On July 30th, 2020, the MCA held our first general meeting since the pandemic started. We used the Zoom video conferencing platform to do so. For today's discussion, I wanted to provide a recap of the information shared at that time, which include COVID-19 information, precautions, and statistics, an update on the MCA's response, information on the AMPS Marine Patrol, and our preparations for a second wave. As you know, the COVID-19 is an infectious disease caused by the most recently discovered coronavirus. This new virus and disease were unknown before the outbreak that began in Wuhan, China, in December of 2019. The World Health Organization declared COVID-19 a global pandemic on March 11th, 2020. The most common symptoms of the COVID-19 are a sustained temperature reading as 100.4 degrees or more, coughing, shortness of breath, or difficulty breathing. Other symptoms that are less common and may affect some patients include aches and pains, nasal congestion, headache, sore throat, diarrhea, loss of taste or smell, a skin rash, discoloration of fingers or toes. These symptoms are usually mild and begin gradually. Some people become infected but only have very mild symptoms. Most people, 80%, recover from the disease without needing hospital treatment. However, 1 out of every 5 person who gets COVID-19 becomes seriously ill and develops difficulty breathing. Older people who have underlying medical conditions such as high blood pressure, lung or heart problems, diabetes or cancer are at high risk of developing serious illness. And it's important that it's important for everyone to understand that anyone can catch the COVID-19 virus and become seriously ill. This is why it's important for everyone to practice all of the recommended precautions to protect every member of our community, especially our most vulnerable. To reduce your chances of being infected or spreading the COVID-19 virus, regularly cleaning and washing your hands with an alcohol-based hand rub or washing them with soap and water. Maintain at least 2 feet, which is 6 feet distance between yourself and others. Avoid going to crowded places. Avoid touching your eyes, nose, and mouth. Making sure you and the people around you follow the good respiratory hygiene. Wear a mask or other face coverings in public places. Stay home and self-isolate, even with minor symptoms such as a cough, headache, or mild fever until you recover, and have someone bring you supplies. If you have questions about the virus or symptoms, we ask that you please call the MCA Community Health Program for a pre-screening by phone. And if needed, they will schedule a COVID-19 test for you. So I just want to share some updated information on the statistics. As of yesterday, there's been 119,674 cases in Canada, 8,981 deaths, and 103,715 in Canada have recovered. Locally, in Franklin County, there's 54 cases, 4 deaths, and 4 have recovered. St. Lawrence County is 263 cases with 4 deaths and 48 recovered. Ottawa has 2,659 cases, 264 deaths, and 2,226 recovered. Montreal is 29,207 cases, 3,452 deaths, and no recoveries. Akwesasne here is 14 cases, 0 deaths, and 0 recovered. It's just important to note some of the numbers and the high numbers in the Montreal area. On March 14th, the Akwesasne Board of Education closed the daycare, schools, and post-secondary programs. On March 16th, the MCA and the Mohawk tribe declared a community-wide state of emergency due to the COVID-19 pandemic, and we activated our emergency operation centers at that time. March 18th is when Canada, United States closed the international border to non-essential travel. Our residents were not affected at that time, but we were advised to use our status cards and cross for only essential purposes. Since then, there have been 4 extensions of the initial closure. The current reopening date is set for August 24th, but further extensions are possible. On March 21st, we instituted protocols for funerals were changed and to allow a maximum of 10 people in funeral homes to ensure social distancing. So this was done by the funeral homes themselves in consultation. March 24th, all MCA facilities were closed to the public and non-essential staff were placed on stand-down status. First confirmed case of COVID-19 was reported by the Franklin County Public Health Department on March 28th. April 3rd, the weekly distribution of emergency food packages started with a focus on distribution to AMBI, low-income families, Meals on Wheels clients, elders, and others in need. April 7th was we began weekly meetings being held between the Mohawk tribe, the Mohawk Nation, the MCA, United States Customs, and CBSA to ensure that all border partners were kept up to date around new developments in our and around our community. April 13th, the Akwesasne emergency curfew law was enacted requiring residents to stay home between 10 p.m. and 6 a.m. and maintain a distance of 2 meters from others while in public, as well requiring those who travel outside of the 50-mile radius, 80-kilometer radius to quarantine or self-isolate in their home for 14 days. On April 20th, our drive-through COVID-19 testing center was opened by the MCA Community Health Program. The testing clinic allows for your results to be received quicker than if you were tested off of the territory. April 28th, long-term care facilities discontinued window visits and encouraged video conferencing instead. On May 5th, we sent letters to all of our cottagers that are on leased lands, advising them that if they access their lots, all emergency measures in place in Akwesasne would apply to them as well. May 7th, it was announced that all residents, staff of our long-term care facilities would be tested for COVID-19 as a precautionary step. On May 11th, the Akwesasne Garden Initiative started delivering a total of 450 garden boxes, soil, plants, and growing instructions to community members throughout the community. May 12th, the MCA established regular bi-weekly calls at first, which later resulted in weekly calls with the Mohawk tribe to continue to update on current COVID-19. MCA managers physically returned to their workstations on June 2nd, which was part of phase 1 of the MCA's resumption plan. On June 8th, the MCA's EOC discontinued operating from 9 to 5, Monday through Friday at the Akwesasne Health Facility, but remained available and operational when the phones were manned by the emergency operation officers who continued to monitor the situation in Akwesasne today and surrounding area. June 15th was our first phase of our frontline employees physically returning to their workstations. This was phase 2 of the MCA's resumption plan. June 18th, where visits to our long-term care facilities began to slowly resume with precautionary measures in place. June 29th, all MCA employees returned to their workstations on a full-time basis, and this was phase 3 of the MCA's resumption plan. On June 29th, as well, the Akwesasne emergency curfew law was amended to change the curfew hours from 10 p.m. to 6 a.m. to 11 p.m. to 5 a.m., but the maximum travel radius would continue to remain the same at 50 miles, 80 kilometers. July 20th, we reopened the facilities of the MCA as part of phase 4 to the community. The precautions in place include masks, barriers, and screening at all reception areas, and social distance and stickers have been placed on the floors throughout the entire organization. July 20th, 3 confirmed cases of COVID-19 in Akwesasne were reported by the Franklin County Public Health Department, bringing the total since the state of emergency declared to 7. July 22nd, 1 additional confirmed case of COVID-19 in Akwesasne was reported by the Franklin County Public Health Department, bringing the total to 8. On July 23rd, an additional 4 confirmed cases of COVID-19 in Akwesasne were reported by the Mohawk Tribe's Health Services, bringing the total of 12, with 4 of them being resolved. August 4th, the Mohawk Tribe EOC reported that they were down to 1 active case. August 10th of this week, the Akwesasne emergency curfew law has been amended that requires to quarantine or isolate for non-essential travel outside of the community. So the community health nurses are reporting that since March, right until August 9th, they have received 1,950 COVID calls to their office with questions, follow-up. And since March until August 9th, they've administered 465 COVID tests. The work of the health department and the EOC council and our community members who abide by the emergency measures that have been put in place are the reason why the numbers are low, and we want to keep it that way. So yawa for all of your cooperation in keeping our community safe. One of the questions that we continue to receive is about funding that has been received by the federal government, from the federal government to the Mohawk Council of Akwesasne. We have received approximately $1.6 million thus far from various sources, whether it be through the Ministry of Health and Long-Term Care, Ministry of Indigenous Affairs in Ontario, or Indigenous Services Canada. Out of that, we have spent $10,000, approximately $10,000 in PPE, $130,000 in community food distribution, health, COVID supplies of $181,000. The Garden Box Initiative was $187,000. We have spent $85,000 on signage and plexiglass. $358,000 has been spent on staff salary top-ups for working during the pandemic, as well as another $229,000 has been spent on healthcare workers top-up that was mandated by the ministry. The total expenses of this is $1.1 million. We currently have a surplus of $485,000. There's been lots of questions around this. The $485,000 will be used to plan for second wave with the option of the strong possibility of looking at food security for our community as we go forward. This information is also available on our MCA webpage at akwesasne.ca and has been made available on our Facebook page as well. We have received many calls about the Akwesasne Police Services Marine Patrol Unit. On May 21st, the RCMP issued a notice to inform the public as a result of the border closure for non-essential travel that they would be increasing their land and marine patrol in the Cornwall area in an effort to secure the border, deter smuggling activity, and to ensure boaters comply with restrictions related to COVID-19 pandemic. Sporadically throughout early summer, the MCA began receiving reports from concerned community members about the presence of RCMP officers in our territorial waters. The MCA contacted the RCMP to discuss these occurrences and later sent letters to both Valleyfield and Cornwall detachments to remind them that the Akwesasne Police Services is our police force and is responsible for patrolling our waters. AMPS is widely recognized by external forces agencies as a vital partner and an asset for responding to and disrupting organized crime in and around Akwesasne. The RCMP was reminded that when they are needed they are only needed in territorial waters when we request them. AMPS has not at this point requested their assistance. In July, the MCA received reports from community members that the presence of the Sorrente du Quebec SQ officers in territorial waters. We sent a letter very similar to the one we sent the RCMP to the SQ, reminding them that the Akwesasne Police Services is our police force and they are responsible for patrolling our waters. The SQ were reminded that they will only be invited into the territory upon request, and no request has been made. Letters have been received from both the RCMP and SQ indicating that both enforcement agencies are aware and respect the role of the Akwesasne Police Services as a community policing service responsible for the safety and security of our community of Akwesasne. The RCMP and SQ both wish to maintain a respectful and mutual beneficial relationship with AMPS, the MCA, in our community. And in doing so, they have both agreed not to patrol the territorial waters unless AMPS has requested their assistance. All health authorities are anticipating a second wave of the COVID-19 pandemic. And what are we doing to prepare? So we are learning from the first wave, reviewing what went wrong and what has not gone, and what we have learned from our experiences. Community stockpiling of a PPE for our health sector. Food security, we are looking at ways to ensure that we have food security for going forward. Education, we're looking at improving the connectivity for our online learning. Technology, what is needed to improve services to you, the community. Community services, how do we properly deliver services using new technology and remote means? We'll be updating an emergency preparedness law. The difficulty is that people are tired of being isolated and many resist lockdown and quarantine. This is why it's important that everyone in Akwesasne continues to practice all of the recommended precautions. We need to protect our community and especially our most vulnerable community members. Reen, that is everything that I wanted to cover with you this afternoon. That is a recap of all the information that we shared at the MCA general meeting of last month. So I'll turn it back to you, Reen, for any questions that you or the community may have.
All right, thank you very much. Again, we're talking with Abram Benedict from the Mohawk Council of Akwesasne as Grand Chief, and providing some information with regards to a presentation, laying down some of the information points for everyone. We remind you that the phone lines are open, and you can call in your question at 518-358-3427. 613-575-2101. So, Grand Chief, I do have a couple of questions with regards to the areas on the river. We talk about the non-residents coming into our river and hanging out at different parts of our territory by way of swimming on Yellow Island especially. So this caller says residents bought their own signs to mark their property on Yellow Island for non-residents that loiter around the islands in boats. And they would like to know, as the Grand Chief, what you're going to be doing to handle that situation. The caller says some parts of the Yellow Island area didn't get signs. So those people are near that area now, bothering those residents. So they feel that there's some loitering being done by non-residents of Akwesasne in their boats and around our beach areas and things like that. So how is the Mohawk Council of Akwesasne handling this? And especially with regards to the signage and even the no wake zones?
Yeah, so since the pandemic started, everybody has been in lockdown or isolation at home. And then when restrictions were lifted, we've seen lots of people, including our community, take to the waters. And in one of the radio interviews or updates I'd done with you, Rain, we talked about water safety, and it's important that we be safe out on the water while enjoying the beautiful waters that we have here. As a result, we have seen and have heard an increase in calls from community members regarding non-residents occupying beaches, occupying what would be private land, whether it be on Yellow Island or St. Regis Island. As a result, our council has established a committee that has been examining what legal options are available, has also been reaching out to landowners that have properties adjacent to the waterways, that have properties that are close to areas where people have been congregating. The committee has also put some signs up just recently about the no wake. We'll be putting up more signs about private property, and we'll be having conversations with the property owners to ensure that they have not given permission, because we have been made aware that some of the landowners have given permission to their non-Indigenous friends to use some of their waterways. So we need to ensure that where there's permission been given, where there hasn't been. So we are starting an education campaign We are consulting with the Akwesasne Police Services and the landowners as to what options may be available there, but also putting up the signage. So this is something that we are investigating. We are doing legwork on right now. We know that the territorial waters is large, but at the same time is limited, and we want our people to be able to enjoy our waters here without having to worry about unwanted visitors. So we are actively looking at options and having conversations with landowners and putting signs up in the last couple of weeks, and we'll continue to do that to ensure that people are able to enjoy the waters in our territory without having to worry about some of those things. So we are on it.
Working with Mohawk Council of Akwesasne Grand Chief Abram Benedict. He's doing his, we do a bi-monthly, so to speak, update usually every couple of weeks. We do it on a Tuesday. And this time around, we join you on this, the 11th of August. So looking at some of the things that were discussed, I know that since we've gotten back into, people returning to their positions and things like that, how have things been going for the services that are provided to Akwesasne through the Mohawk Council of Akwesasne? How has that transition been with everybody returning to work and then people utilizing the services and learning the new ways that things are going to be done business-wise with the Mohawk Council of Akwesasne? How's that been going, Grand Chief?
Well, from the reports that I got from administration, things seem to be going well. There was a time when all of the employees were finally back into the organization. All the modifications had been made, but the MCA was not open to the public yet, so that the workplace can have an opportunity to adjust to the new precautions and restrictions that are in place. So now that our facilities are back open, community has been respecting all of the requirements for entering in the facility. The workforce has been doing, as much remotely as possible as well, because some community members are not comfortable with being, close to people or having to access services physically. So there still continues to be an adaptation of what, the situation in which we are in now. But I think for most parts, things are going well.
Taking a look at another question from one of our listeners, they would like to know, why are we the only community with a curfew and a 50-mile radius restriction? So looking at why we're the only community in our area with that curfew and a 50-mile radius restriction, and that would be under the guidance of the Mohawk Council of Akwesasne jurisdiction.
Well, I'm not sure that we're the only community with curfew or travel restrictions. I participate in calls with the Chiefs of Ontario. Other communities are taking similar actions. Some communities have barriers or checkpoints still on the outside of exterior of their communities, so that they are not allowing non-residents into the community. Of course, here in Akwesasne, given that we're geographically located where the international border runs through, that you have to, Stoney and St. Regis, or you have to go through Hogansburg to get there. It's not as easy to have community barriers, but the curfew and the travel radius still continue to be in place. Were put in place for the protection of the community to ensure that the virus doesn't spread, rapidly into our community. We do know that a lot, if not all, of the cases that have been confirmed in our community have been related to people traveling outside of the community or from outside of the community into the community. And the other thing that's troubling about, not troubling, but that is concerning about traveling distances from the community is that Montreal still continues to have a large number of cases, and it is only, about 100 kilometers down the road, and we really want people to, continue to be cautious. We are evaluating every week the curfew and the travel radius, but at this time, we continue to maintain it in effect for the protection of all of our community. As the numbers continue to come down, this will, these things will be relaxed at some point, but that's, we are not the only community that are taking such precautions to protect our people.
All right, now going to the Zoom meeting for the Mohawk Council of Akwesasne, how did that go for you with regards to the first time holding the general meeting in the capacity of Zoom? Is that something that we're going to continue doing? What are your thoughts on how that went for MCA?
Well, as the Grand Chief, I'm the chairperson of the meeting. So, I mean, I think that it went as well as could be expected for the first meeting. I think that, I do want to acknowledge that you're using Zoom today too, Reen. I can't see you, but I know you're there, so that's good. We did a presentation as we've just gone through today. A lot of the points that I covered on the radio here with you today were the same points that we covered at the general meeting. We had a number of great questions that were received ahead of time that we were able to go through all of those questions and answer them for the community. And I think that, while we want to be, physically be able to have these meetings, we're not at that point yet. People are not comfortable at that point. We're going to have to continue to use Zoom. In fact, we will be having a Zoom update on August 20th with the Chief of Police for the Akwesasne Police Services and myself talking about community policing, talking about policing priorities, accountabilities, policies in 2 weeks on, and we'll be using the Zoom platform as well. This is an effort to ensure that we continue to respond to community inquiries, but also to ensure that we're being transparent and accountable to the community. So this is a platform that we're using for now. We will likely continue to use for the next foreseeable future. We're asking people to embrace it for now, and until we're able to safely meet in person again and congregate numbers, the system is going to have to be the system that we'll continue to use.
All right, again, we're talking with the Grand Chief, Mohawk Council of Akwesasne, Abram Benedict, and providing an update for the community and different things that the Mohawk Council of Akwesasne has been handling, also the response to the COVID-19 pandemic. So looking at another piece of the general meeting, Grand Chief, I was able to watch the general meeting in its entirety at my leisure on, my device. Which was awesome. I didn't have to go to somewhere, at 7 o'clock at night or something. I could watch at my convenience. So I enjoyed that. One of the things that I noticed at the end of the MCA general meeting was the announcement for the road that had been, the bid had been successful. And can you tell us about that? I know a lot of people have been waiting a very long time for that information regarding the road that was needing much attention over the years in the district of Sny.
Yeah, so we did receive that question, and I do want to thank that person for raising that question. It was about when is Wade LaFrance Road going to be repaired? And I can tell you that we have received lots of calls about this. Unfortunately, the way the process works, it takes time. We have to plan, we have to engineer, we have to have the bidding process, we have to secure money. So while it may seem easy and quick to be able to repair a road, it's not always that easy and quick. So, but regardless, we have gone to the point where we have awarded a contract for the first phase of the reconstruction, which means that they will be tearing it down and then replacing it to a grade that's going to be much better than it is now. And then come next year, they'll put a final top on it. So I'm pleased to announce that Wade LaFrance Road is slated to be repaired very soon this year. We continue to look at other priority roads within the community, but I'm glad that this road is being able to be repaired. Believe me that we've heard lots from the community on this, and our district chiefs have been working very hard to ensure that we meet the need, and there is some movement happening on it now.
Next question has to do with personal time. And a lot of times with elected leadership, you go to your job, you do your representation of the community, and then you have your personal time where you're off the clock, you're with your family or you're with your friends, and people watch people. Now, looking at someone, saying that they witnessed an elected leader not social distancing, not wearing a mask outside of work hours in different places. What are your thoughts on that? And how would you handle that if it was you that was called out on that?
Well, I'm pretty sure this is about me. I will hit that one right on. And what I can say is that it's not for me or any member of council to go and investigate who people's social bubble is. As you know, we have been talking about precautions all along and that people should remain within their social bubbles. So I expect that all of the members of council, including me, would take all precautions necessary and would select who their social bubble is and that they're comfortable with. And that's, that's of all persons in our community to protect ourselves and our community.
And our next question has to do with regards to the 50-mile radius. 50 miles or 80 kilometers under the jurisdiction of the Mohawk Council of Akwesasne. Grand Chief, this caller wants to know, does the Akwesasne Mohawk Police Service Chief of Police live outside that 50-mile, 80-kilometer radius? And if yes, why is he allowed to go back and forth to work without quarantining?
There are, from my understanding, a number of employees that live outside of the 50-mile, 80-kilometer radius within the Mohawk Council who provide services as employees to the community. And that, it is not possible for them to be able to quarantine at their place of work. But since they have been asked to take all necessary precautions, as we all have been, to ensure that they're not putting themselves in a risky position that will bring the virus to the community, or that they'll take the virus to their home. Since then, the law that requires persons to quarantine for going outside of the 50-mile radius has been amended to be reflective of essential reasons. So persons that have to travel outside of the community or travel into the community outside of the 50 miles are no longer required to. But prior to that, they were asked that they take all due course to ensure that they are not putting themselves or their workplace or their families at risk.
Right, our next question for the Grand Chief. Would Chief and Council mandate frontline workers, such as teachers, childcare workers, social workers, to do the COVID testing every 2 weeks as a safeguard for their involvement and interaction with community members? So it looks like this caller wants to know, will you mandate the frontline workers to get the COVID test every 2 weeks?
So currently as it exists now, the long-term care facilities that are funded by the Ministry of Long-Term Care have a requirement to be tested every so often. As in the presentation I done earlier, there was a date that had started that continues to take place as of now. This is an administrative decision. If the administration feels that it's necessary to institute regular testing for regular sectors or all sectors of the community. Let's remember, though, that a very large portion of the people that work for the Mohawk Council are Akwesasne from our community, which means then so that, if they are in their workplace or if they are at home on their own time, they should continue to take precautions to make sure that they are safe and their family is safe, which then translates into meaning that it's a safe workplace that they are at. So, we want everybody to continue to do their part to keep us safe, keep themselves safe. The testing for teachers, daycare workers, or all employees is a decision that administration can examine. But I think that if we have to continue to test our people, then there may be some other issues that are happening that are leading to that. But we'll take that under advisement.
All right, we have another comment, Grand Chief. I appreciate the curfew, but even after we raised it to 11 p.m., this caller feels there was still some racing around at 1:30 in the morning. Again, this is just a comment from one of our listeners.
I encourage people that are concerned about activities in our community past the curfew or at any time to please make a call to the Akwesasne Police Services and file a complaint with them. that there may be suspicious activities, persons driving erratic, etc. They cannot respond if they don't know.
Next question, is it still the case that people quarantine for 14 days when they return from outside the 50-mile, 80-kilometer radius? That's another comment from one of our listeners.
Yes, it is. It still continues to be under the jurisdiction of the Mohawk Council. The restrictions are 50 miles or 80 kilometers.
All right, another question from a listener. What is essential services to travel outside of the 50-mile, 80-kilometer radius for an MCA employee? For example, taking people to appointments. They would like you to please clarify what is considered essential.
Yeah, so healthcare is involved in that. Going to doctor's appointments, etc., is involved in that. Persons who work outside of the community and have to provide for their family members is involved in that. That change will be announced later today, if not tomorrow, on exactly what that definition is. I know that we have lots of calls on this in our sessions, Reen, about the 50 miles and what what people should or should not be doing. We have to remember that these safeguards are in place so that we don't have family outings in downtown Montreal. So we don't have family outings in the city of Ottawa. People are leisurely about and bringing the virus back to our community. Again, most positive cases in our community have been associated with persons traveling outside of the community or persons traveling into the community from outside of the radius of the 50 miles and infecting persons here. So these are safeguards in place to be able to protect ourselves, our dudas, our children. People need to take due course. So but the announcement will be coming out exactly what the essential is. But we know that we do not want to deter people from going to Ottawa to have follow up with their doctors, to have tests done, to have procedures done, and that's why these changes have been made so that they accommodate those situations. You've got to remember to hit the unmute button there, Reen.
There
we go, Reen. Reen, you were muted there for a second.
Okay. All right. So we're good to go. Again, we're talking with Mohawk Council of Akwesasne Grand Chief Abram Benedict. So right now I'm going to close down the phone lines. So we appreciate everybody's phone calls. We'll be wrapping up with the Grand Chief about 10 after 1, okay? So continuing on with your questions. And again, the phone lines are now closed. We appreciate everybody phoning in. You can view this in case you're just tuning in or in case you're on Facebook right now and can see the Facebook Live portion of the Zoom broadcast today. You can view this in its entirety later on at your convenience. We're also going to re-air the program right before CKON Radio Bingo tonight, so you'll be able to listen to it before Bingo. And you can also find it on the MCA YouTube page as well on their YouTube channel. So next question has to do with nursing staff in long-term care. Will the nursing staff in long-term care get the 6% hazard pay after the $4 an hour increase ends August 13th? Again, that question, will the nursing staff in long-term care get the 6% hazard pay after the $4 an hour increase ends October 13th?
Yeah, so this question was brought up at the general meeting as well. We provided, and those of you who have access to the internet can watch the entire video. There is a PowerPoint presentation on there that gives a bit more of an explanation or has a detailed graph on there. The 6% that's provided to all employees, that decision has not been made when that will continue to. If the $4 gets discontinued and the 6% is still available, then yes, they will. But those, those decisions, the $4 is ministry mandated. The 6% is an MCA initiative that continues to be revisited. But the question is yes.
Look at our next offering from a listener. The 6% hazard pay that the nurses received that they have to pay back. Do you include that in your budget? The money they are paying back, what will it go to? So again, the way that it's worded, it says the 6% hazard pay that the nurses received that they have to pay back, in parentheses. Do you include that in your budget? And again, in parentheses, the money they are paying back, and what will it go to?
Yeah, so any employee who has questions about the 6% and the $4 should speak to their supervisor and the MCA Human Resource Department about this. I am not an administrator, the administrator of the MCA, and nor is my counsel, but we are aware of some of how this works. I can tell you that though, on a dollar for dollar value, the ministry has not provided us the total cost of the $4 per hour. So the ministry has said to us, you have to provide certain healthcare workers with $4 an hour more, but they have not provided the money to back that up. So when, we have to comply with what they're saying, whether or not this was budgeted, some of that money they sent to us for the $4, they have not. So that money that over and above will likely come out of the other monies that we received for other community initiatives. The 6% as well was not budgeted because we didn't budget for a pandemic to happen in March, but also is being used the same pots of money that was received from the government to support the 6% as well. So it's the end of the day, it's not a budgeted expense, so it will have to be covered through either existing resources or new resources.
Akwesasne, Abram Benedict, answering questions from community members today. Again, we appreciate everybody phoning in with their questions, and we'll be wrapping up very shortly. And of course, Mohawk Council of Akwesasne holding their general meeting for the first time on Zoom. Grand Chief, do you have a meeting date for the next general meeting?
Yes, the next general meeting will be August 27th, same time, 6 p.m., which is going to be the last Thursday of August. We'll use the same format. We'll ask people to please email their questions ahead of time if they want them to be answered to meetings@akwesasne.ca. So we ask that they please send their questions in. If there is time, we will take questions from the people on the Zoom platform. We will have a presentation. The agenda has not been set yet.
All right, another question. Will council view COVID-19 by case fatalities rather than total number of cases? That way we can move away from the strict regulations. Again, that question, will council view COVID-19 by case fatalities rather than total number of cases? That way we can move away from the strict regulations. What are your thoughts on that?
I'm sorry, I don't completely understand the question. I think that maybe it's about how it's reported. I know that we've had lots of conversations about the numbers reported, meaning the number of positive tests versus the number of deaths and the number of recovered. People get a bit fixated on the numbers, but I think that, the important part is that we don't ever want any numbers, and we want people to continue to do their part to be safe, to keep us safe, and to keep their risks low, so that we can continue to keep the numbers low. But we're always looking at ways to continue to report those numbers. If there are suggestions, they can let us know, whether on the Facebook page or message us, and we can look at other ways of reporting them.
All right, now, how does the Mohawk Council of Akwesasne work in conjunction with the Akwesasne Mohawk Board of Education? Does Grand Chief and Council, do they have any input or say on what's going to happen with our 3 district schools, on whether the kids are going back full-time, hybrid, how that's all going to work out? Do you guys have any say in that?
We have, through our portfolio system, 2 chiefs who are portfolio chiefs for the education portfolio. So they liaise with council and the Akwesasne Board of Education. The Akwesasne Board of Education has elected trustees as well. They have 2 per district, so they have 6 members who are elected by the entire community, which we've had a board since 1987. that oversee and guide, the operations of the Board of Education. So there is a link there. They provide us with regular updates, but I encourage persons who have issues with or concerns about the governance of the Board of Education to reach out to their elected officials as well and have a conversation with our members of council who are education portfolio, but they are our link. They keep us updated. We do provide them with input as the Board of Education works towards making decisions, especially on this time of COVID. So we do have that connection there, and there are regular communications with the Board of Education. Irene, you're going to have to get used to unmuting yourself on the Zoom platform because
there we go. How's that? Better? All right.
Okay. That happened to me a lot too in the beginning.
Yeah, so we're trying to do this so it sounds better for our listeners. We're finally able to get the equipment we needed to be able to conduct this. So thank you for doing it with us. The first one we did this morning was with Dwayne and Norm from the school boards. And I think we got through it okay. But it all depends on people's Wi-Fi signal and stuff. So that's the only thing that scares me a little bit. I have to trust Wi-Fi, which is scary. But looking at chief and council, we talked a little bit about it earlier. People on their personal time, whether you're an elected leader or you are an employee of the Mohawk Council of Akwesasne. So this caller says chief and council, if they're off work, it's their personal life. And this caller says, then why is it that our employees for MCA are scrutinized for what they do in their personal lives? Why is chief and council different than employees of the organization?
I'm not all entirely sure that that's an accurate statement. You'd asked me earlier about an incident, which I'm pretty sure was aimed at me. That was not on council time. So I can tell you that, the message or the tone that's set to the members of council is that, you're an elected leader all of the time, that your conduct is always being watched, that you need to set the tone of what is expected from you as leadership. And that you're expected to conduct yourself in a manner that represents your elected position. So, that is what I believe that they all understand. That is, what I expect as the Grand Chief, as the leader of the visionary and the chairperson of the council, of how they should conduct themselves. Staff are that ultimately is administration, but I can assure you that members of council do know that their conduct is supposed to be incumbent of an elected person all the time, whether it be Monday through Friday or any other time. You're leaving me dead air again, Reen.
With regards to the Mohawk Council of Akwesasne and the setup, you have chief, you have grand chief, and you have our district chief, so chief and council, and then you have someone who runs the administrative portion of the Mohawk Council of Akwesasne, and then do you have heads of the social services and heads of the Department of Health? Are those the correct tops of the umbrella for MCA?
So the MCA, the council, chief and council is responsible for one position, and that's the executive director. The executive director is responsible for the day-to-day operations of the organization, and she has an executive management team that report to her, which includes the director of health, the director of social services, the director of justice. There's eight departments within the organization that report to her. So that is the structure. There should be an organizational chart available at our akwesasne.ca website that'll help illustrate what that reporting requirements look like. But for the chief and council, there is one employee, and that's the executive director.
And who is the executive director?
The executive director currently is Heather Phillips.
Alrighty, I think that's all that they asked about on that one. Grand Chief, I believe we're going to come to an end now. So I'd like you to wrap up with your closing comments. And again, we appreciate everyone listening in and calling in with their questions and comments for the Grand Chief of the Mohawk Council of Akwesasne for his update this afternoon. We appreciate that. Grand Chief, wrap up, please.
Absolutely. Thank you, Reen. And again, I just want to mention that we will be having in 2 weeks, on August 20th, a live information session with myself and the Chief of Police at 6 p.m. talking about community policing policies, accountability for the Akwesasne Police Services. Persons who want to ask questions or have their questions answered are encouraged to email meetings@akwesasne.ca prior to the 20th so that your questions are answered. We will be having the general meeting again, which will be live, will be on the Zoom platform on the 27th of August, again at 6 p.m. For the community members. I know this is not perfect, but this is the situation in which we are in now. So I encourage all of you to participate in that, or as you had mentioned earlier, Reen, to listen in afterwards to hear some of your questions answered, or just to hear updates from myself and council. So over the last 5 months has been very trying for everyone. I can't repeat enough that we must continue to do our part, which includes wearing a mask and maintaining the 2-meter distance from others while in public and avoiding social gatherings. I know this hasn't been easy. It has not been easy for me and our families. It's not and has not been easy for our community. We have to continue to take this one day at a time and support each other along the way. This is going to continue to be how it is for the next foreseeable future. Reen, I want to thank you for taking the time as always. I do my best to continue to keep you and the community updated. And I want to say yango to all the employees in our community who are working hard to keep our community safe. And to you, our listeners and the community members, for doing your part to keep us all safe during these very extraordinary times. So yamagoa, Reen, yamagoa to our listeners, and hopefully we'll talk again in the next couple of weeks.